Hello, everybody. Hi, this is Dr. Alicia, and I want to welcome everybody to Healing Haven. We are today going to have another fascinating, interesting conversation. We're talking about teenage love today, and I have a special guest, which I will introduce in a second, but I want to welcome everybody. Hello, Healing Haven family. Hello, everyone. I can't wait till you guys get situated in here. Be sure to meet us in the chat. Be sure to put your name and where you're from, and I can shout you out. Also, we're going to have a great conversation today about teen love or toxic love. We're going to be talking about how to spot narcissism just as it starts to bud and how we can build healthy hearts. And I am Dr. Alicia, and you are tuning in to Healing Haven interview. And I want to invite everybody and say hello. Hey, Naomi from NYC. That's what's up, from New York. I'd like for everybody to hit the like button. Listen, y'all know teenagers, be sure to hit the like button, but be sure to share this with any teenager that you know, or share this with a parent of a teenager. Be sure to share this video with them, because we're going to have a great conversation about how to have healthy relationships and how we're going to be able to talk to and guide teenagers on what is healthy love and what is not healthy love. They don't know, really. They really don't know. Anyway, I also want to invite everybody to text the word love. Let me see if I can find it over here. Here it is. I want to invite everybody to text the word love, LOVE, to 87948, and you will get a text message when I go live on Mondays, when I go live on Sundays, and I also go live on Tuesdays with Fly Nubian Queen, and you'll be informed about what's happening. Then if you are interested in reaching out to me to work with me individually, of course, there's my website, coachingwithdralicia.com, with the M over there. And then you can follow me on social media at Coaching with Dr. Alicia. And so now that you guys know where to find me and all of that fun stuff, and let me see who else is in here with us. As you come on in, I see y'all trickling in there. As you come on in, be sure to say hello to everybody. Hey, Lori from Michigan. What's up? We got the East Coast. We got the Midwest. I myself I'm in the Midwest, and my guest here is from the East Coast. So we got it aligned here. Anyway, let's see. Tonight, we are asking a huge question: teen love or toxic love. We're talking about adolescence. It is when our heart first learns its rhythm. Sometimes it goes into very dangerous territory. So today we're going to unpack some of the early signs of toxic relationships. We're going to talk about practical boundaries, and we're going to show how we can raise teens to have relationships with each other in a way that leads with empathy, not focusing on ego. And to guide us in our conversation today is a wonderful guy named Dr. Ulrich, and he is a psychiatrist, everybody. He is a child and adolescent psychiatrist. He is located in Maywood, New Jersey, and he is here. He specializes in toxic relationships and talking about narcissism and where it's coming from. Dr. Ulrich, welcome to Healing Haven.
It's a pleasure. It's a pleasure to be here.
Yeah, so well, before we get started, I just want you to let everybody know what drew you into studying toxic relational dynamics, and particularly with adolescents. That's the most difficult population there is. What drew you to this area?
Well, I mean, that's a great question. And the funny thing about it was medical school. I was torn between family medicine and psychiatry. I decided at that time to do family medicine first because, again, there was a stigma about going into psychiatry, going into mental health. I was doing my family medicine residency. I'm treating patients. There's a very large component of OBGYN. I delivered over 40, 45 babies. And I was always fascinated by the relationship of the mother and the father, and how important it is to have the father involved, even within teenage relationships. So, based on that experience, I found my calling after my family medicine residency. I retrained as a psychiatrist. I did general psychiatry, then I did a child and adolescent psychiatry fellowship. And again, still working with kids, still working with teenagers. And what I love about working with teenagers is the concept that you can change a generation. It
Mhm.
adequately approach the struggles, the challenges that a teenager has, and you help guide them, that will be a lifetime benefit that will also affect future generations. And that was what really drew me into the field of child and adolescent psychiatry.
Wow, I think that is so interesting. Like, I feel like I used to work with teenagers too, and it is really a fascinating age group because it was so different from working with smaller children. So I used to work in the child parent centers. Remember when child parent centers were real popular back in the 90s and the early 2000s? I used to work in the child parent center with the little ones, and then I just found that I ended up having to work with the parents mostly because they're so tiny. And then I switched schools and I was doing just community counseling in the schools. And I worked at a school in Chicago. It was a community school. So that was also popular, communities in schools. And working with teenagers were really, really, it was challenging, but it was also very rewarding because I was working with kids that were at a crossroad.
Yeah.
It's like you either go this way or you go that way. And the decisions that they made at that age was so important. And it was just so fascinating because their hormones are going, their budding hormones are all over the place. They starting to become attracted, you know, romantically attracted to people, trying to figure out who and what they are. And it was never a dull moment working with inner city teenagers. And I've worked with teenagers all over, and I find that they all have this commonality there where their cognitive skills were at such a level where I could really do good work with them. But at the same time, it was just really sometimes chaotic. So I don't know. I just find teenagers to be a lot of fun. And before I go on to my question for you, I want anybody in the chat, all of you all looking in, y'all tell us, do y'all remember your first love as a teenager when you were in high school? I want you all to picture whoever you dated in high school. Picture that person in your head and what all went on in that relationship. And then let us know if it measures up to what Dr. Ulrich has got to say. So my question to you is, when a teen starts dating, what early signs can distinguish a healthy learning curve mistake from the first flags of a really emotionally toxic pattern? What is it that you've learned about how to distinguish among teenagers when they start dating? How are they going to be able to see whether this is a really healthy way of being in a relationship or whether it is emotionally toxic?
That's a great question. I think a lot of it also depends on the culture you come from, because some cultures, they don't allow dating, or at least dating is they're very conservative, right? What
Mm.
things in a relationship that you want to look at, and you want to differentiate between what is abusive and what is toxic and what is just natural challenges. I mean, I think in a relationship, you're going to argue with your partner. If there aren't any arguments, if there isn't any challenges, that's not necessarily a good sign. But the key thing is that it's toxic when there's a mental abuse, physical abuse, emotional social abuse. When it gets to the point you are walking on eggshells, when you are in a relationship and you find yourself isolating from other people,
Yes.
and there's a level of splitting. You are never vindicated. Those are concerns, because in a healthy relationship, you should be able to grow. You
Mm-hmm.
shouldn't feel guilty. You know, you want a partner you to be able to apologize when they make a mistake. If
Yes.
you are in a situation where it's always your fault, that's a problem. And when you are trying to maintain boundaries, that that person needs to respect that. And I will tell you why this is so important. Developing these life skills is essential, because how, in many ways, some people will say that the way you are interacting in your quote unquote romantic relationships can also be a sign on how you're interacting in other relationships, whether it's business, whether it's work, you know, being able to actually maintain those boundaries. So I think that's really important. I will never forget one of my good friends in residency. You know, we were talking about one of our colleagues that was in a very, very bad relationship. It was a toxic relationship. And my friend said, you know, you've got to leave this person. And you're like, well, I don't know if I can do that. I don't know if I can do this. But then he said, well, you gotta look at it like this. It's kind of like having a broken leg. You can
Mm.
ignore the broken leg, even though it may not be what we call a compound fracture, where the bone is sticking out. It might be like a stress fracture, because it's a stress fracture. I'll keep on walking on that leg. But is that really healthy? No. You got to take care of that. You've got to move on. You've got to adequately, acutely treat that problem right there. And then he said that if you're not able to maintain your boundaries, if you're not able to adequately advocate
Mm.
self in that relationship, it's going to be a challenge for you to advocate for yourself in other aspects of your life, whether it's in the work environment, whether it's working with family members that may be a little bit toxic.
Mm-hmm.
So it's that exercise.
Yeah, I think that's really interesting. As you were talking, I definitely could. I'm thinking of all sorts of illustrations, because working with teenagers, you're just taking me back to my old practice days in Chicago. Like, I just remember like talking with teenage, you know, romantic partners, and I remember them going into it thinking, okay, you got to let your partner have friends. Just because you're dating somebody doesn't mean that you're going to be their only friend. Like, let them have other friends. There was this possessiveness that I found that was happening with when I was working with teenagers. Like, no, it's okay if they have friends of the opposite sex. That's quite all right. Like, that's healthy, as a matter of fact. You have to stop being so jealous. I just remember jealousy and fights over boys and all of this stuff that I used to see going on. And I'm like, look, if he wants you, you don't need to fight over him. You know, he will pick and choose who he wants. And I just remember, like, you talked about that isolation and social isolation. Sometimes I would see a nice, really sweet, smart, young girl, you know, straight A students. I remember seeing some of the girls in particular get into a relationship with an older guy, and she never even talked to any of her friends anymore. All she did was hang out with this guy who had a car, maybe have had some money, and that's all she talked to. She would abandon her friends. And I remember thinking, like, that's not necessarily pretty healthy. I saw that as being really toxic and potentially abusive, because they no longer are interested in doing age appropriate things. So that was the first thing. And then, you know, now we're in 2025, and I see a lot of teenagers this age, and y'all can tell me in the chat if you think this is appropriate or not, but there's this common thing where in teenage love nowadays, they like to share their location.
Yeah.
I'm like, don't share your location with somebody. Like, I would never in a million years expect my husband to share his location with me. Like, he's where he said he's going to be. Like, and if he isn't, I'm sure it's a good reason why he's not there. And who cares? Like, I don't have time to be keeping up with somebody. But I couldn't, fathom the idea that it is absolutely normal. You talked about culture. It is absolutely, did you know this? It is absolutely normal right now for teenagers who are dating right now to just share their location with each other. Like it's like a given. And I don't see that to be the case. What do you think about that? Sharing location and not letting people have friends of their own.
I think it's really concerning, and I guess my concern is what is the underlying cause? What's the underlying ideology? One of the things that why this topic is so serious and important is that when you're dealing with, if you're in a toxic relationship, that can lead to serious medical issues. What am I talking about? I'm talking about the concept of what we call epigenetics. So we've seen that trauma can actually have an adverse effect on your DNA. It can either be what we call DNA methylation, modification. And what I'm saying is that one good thing about this is that these changes are not necessary. They are reversible, but DNA is kind of like the blueprint of who you are, whereas epigenetics is what turns on and off these genes. So can lead to PTSD, can lead to anxiety, can lead to depression. That can be passed on to future generations. So this is why I'm always concerned. I do not like the statement when people say, well, something bad happened to you 10 years ago, something bad happened to your parents or whatever, get over it. You can't say that because we've had studies of Holocaust survivors that we've seen that they have a higher level of cortisol. Why are we concerned about cortisol? Well, cortisol leads to inflammation. Inflammation can lead to cancers. It can lead to cardiovascular disease. It can lead to heart disease, right? So this is why understanding these toxic relationships is really important, trying to minimize that. And going back to your initial question, is that this desire to know where a person is at every time. I can tell you as a physician executive, it doesn't work if I'm trying to micromanage a person. And you don't want to be in a situation where you're micromanaging your relationship, because it's going to become a self-fulfilling prophecy as far as that relationship is concerned, because that person may just stop and say that this is not for me, right? Because that person may be trying to maintain their boundaries. It's not going to be good for you as well, because you kind of want to be in a situation where, going back to your initial question of what is a healthy relationship? A healthy relationship is trust. I should be able to talk to my partner and share my fears with the hope that my partner can give me advice, can help me see things that I don't see. This is one of the beauties of therapy. Part of therapy is that we all have blind spots, but a really solid therapist will help you identify your blind spots. But that is essentially something that you should do. I mean, what's one of the core statements of DBT, dialectical behavioral therapy? You may have had a very, very difficult life. You may have been given things that were not fair for you, but ultimately it's your responsibility for you to lead the life that you want to live. Now, some people may say, oh my God, that is such a cold statement to say. Where's the empathy? But think about it. That's like really empowering.
Oof.
I came from a difficult background, you know, difficult household, whatever. But I was able to lead a life that I'm satisfied, that I'm proud of. That's so empowering.
Yeah, that's really good. It's so funny. I was looking at Naomi here talking about teenagers nowadays. It is so normal for them to just share their location with their friends. I know
Yeah.
I was talking to my daughter. We went to her dance competition. She had nationals in Florida. She knew where everybody on the dance team was. Oh, so and so is on her way down. She knew, they know the location. I'm like, why are you sharing the location? It's just a normal thing that's embedded in nowadays teenage culture on Snapchat. So they send Snapchats back to each other, but they know exactly where it's a map of the United States. They know exactly where everybody's located. But not only do their friends know where everybody's located, but I don't know, this app knows where everybody is located. I just think it's just so strange to me that friends would share their location like that. And you're right. You know, the epigenetics and all of that kind of primes us to what we're kind of used to, but it is now embedded in our culture that, especially young culture, that you automatically share your location with somebody. And I thought that was like strange to me as a therapist. I'm just like, I would never suggest this. And if I had a teenage couple in front of me or a young person, I would like be questioning some of these things. And I don't know, I just think it's interesting, but
also,
yeah.
I think that's a good point. I think, and one of the challenges that I have is that something as a therapist, and I guess I'm old school because I'm a psychodynamic therapist, do CBT and DBT, and one of the goals of psychodynamic psychotherapy is, again, you kind of like a mirror. You're not necessarily sharing or telling your perspective to the patient, but you want the patient to be able to define their own reality.
Yeah.
I will say that we also have to be careful that what was normal in our generation
Yeah.
be normal in this generation. And I will say that this generation is a little bit different. So I would say maybe one positive thing is that at least people know where they're going, especially when you look at these issues of trafficking and all.
Yeah.
Because my biggest concern is the isolation. I don't,
Yeah.
that to me, if I were to list a number of priorities, my number one priority or my number one concern would be a teenager that's isolating themselves.
Yeah.
The one that, that's not that no only has one friend, only one friend. You know,
Right.
they don't have a friend group, because those are our, or, and as you said, a person that's dating a much older person, especially for, I could say, but even in males. I mean, we often miss,
Yes.
we miss that perspective, and oftentimes, males that have been abused, we completely miss it.
Yeah, we do. And I mean, you even think about like at this age, you're right about having friends is so important. And that's the tragic part of COVID, like
Yeah,
making everybody stay inside, because now we got a whole entire cohort of people that just don't have a true identity that's formed. Because how are you supposed to know who and what you are as a teenager and feel good about yourself if you haven't quite established an identity? Like, even I didn't have to experience COVID when I was a teenager. And I remember boyfriends I had in high school. Yes, I had a boyfriend in high school, but I remember boyfriends I had in high school, and there's no way I could ever have like had a long term relationship with any of them, mainly because I didn't even know who I was. How am I supposed to pick a partner? And I didn't know who I was. And part of the dating scene, when I was, especially when I was really young, 16, 17, was trying to discover who and what I am. Like, my identity is still forming. What do I want to be? And part of figuring out who I am is dating people, getting to know people, and it's so funny because me and my friends, we would bond. We would like, you know, be really good girlfriends and stuff, because our link together was to see what cute guys were doing. You know, that was just like a fun sort of thing to do. I look back on it like, but it's just like normal fun things that I feel like with COVID, a lot of cohort of individuals just missed out on that. Have you noticed this being like an issue in your practice?
Oh my gosh. I mean, not just, you know, part of my job, I'm a residency training director, and I will never forget. I was talking to a couple of program directors, and program directors, you know, we're hire medical students and we teach them how to become psychiatrists. And there was a cohort of residents that had never interviewed a patient in an outpatient setting face to face.
Oh,
Now, I stated that I'm psychoanalytically trained. That means that 3 years I was in the couch 3 to 4 times a week.
whew.
And there were no telephone calls. I had to go to the couch 3 to 4 times a week. So I'm going from that perspective to a perspective where you've never been in a room in an outpatient setting with a patient. Everything's been virtual.
Mm.
I mean, about this is, but this is the thing that's so wild is that sometimes some patients like that.
Well, I don't know. I had some teenagers during COVID that I was seeing at a private practice office,
Mm-hmm.
and they were so traumatized by Zoom that when, even in the midst of COVID, they refused to meet with me on Zoom. Their anxiety was so heightened that they were just like, Dr. Alicia, I need to talk to you, and I do not want to talk to you on Zoom. I must talk to you face to face. And I have a little girl that I still work with. I've been working with her since she was in the 8th grade. She's like 20 years old now. She saw her grow up and everything. A really nice little girl, but she's like, there's no way. I said, we can meet on Zoom. I can meet with you anytime you want. She said, no, if you're out of town, I'll just wait till you come back in town because I can't meet on Zoom with anybody. Just the idea of it just sends her spiraling. She can only meet in person. And I just found that to be pretty common among people. There's just their association with this digital world. They kind of turned off by it. But of course, that doesn't necessarily mean everybody. But I noticed that it was really fascinating. Have you noticed any of that in your practice?
Well, I mean, definitely, like a lot of the kids, the adolescents that I treat, they definitely like. I mean, it goes both ways. I have some adolescents I have to see them face to face, but I also have some adolescents, you know, believe it or not, COVID was a blessing for them.
Yeah.
Because especially the ones that had social anxiety, the great, you know, sky high, you know, because they didn't need to deal with that. They didn't, you know, even some of my kids that were victims of being bullied. Kids, you know, did pretty well with it. Now, I will say one of the advantages of the aspect of the Zoom is that sometimes, because I mentioned I am the director of the sports and performance clinic, some of my high-end athletes, after school, they're going here, they're going there, blah, blah, blah. So I'm basically doing sessions, in the, you know, so, or whatever, you know, I'm checking up on them. So they constantly, you know, the accessibility has actually increased. So that's the thing in life. There's pros and cons. And from an individual perspective, what makes sense for you?
Yeah, it's a double-edged sword there. It really, for some, in some cases, it really is a great thing. It's way more convenient. But for some other individuals, it doesn't necessarily feel right to them. I never thought in a million years that I would be conducting therapy online. And so, yeah, I find that to be really interesting. So, hey, everybody. I see a bunch of people in here now. Welcome, everybody, to Healing Conversations. Today, we're talking about teen love or toxic love. We're talking about how to spot narcissism or toxic relationships and versus how to spot building healthy relationships with our youngest people who are just on the brink of dating, or at least acknowledging all of these hormones in their body. They're becoming attracted to other people. And I have my esteemed guest here, Miss Dr. Ulrich, who is a psychiatrist, and he specializes in healthy relationships, narcissism, and he is the director of the child and adolescent program. And what's the name of your institution?
Hackensack University Medical Center of the Hackensack Meridian.
Hackensack.
One hospital system in the state of New Jersey.
All right, in the state of New Jersey. That's what's up. So everybody from New Jersey, how y'all doing? Try to talk with a New Jersey accent. Anyway, so we're talking about this, and I'm encouraging everybody, parents of teenagers, y'all chime in here. How do you all deal with looking at patterns and signs of healthy relationship in when your children, teenage children, are dating? How do you recognize if it's healthy, if it's not healthy? Any of you guys watching, y'all know parents of teenagers, be sure to hit the like button and be sure to share this video with them, because we're about to get down to it. Dr. Ulrich, what do we do? What would you say to parents of teenagers who are dating? How are we to spot and tell the signs of what is healthy relationship and what is not, for parents to look at?
One thing that I really want to emphasize as a parent, please, if there's one thing that you get out of this talk today, please maintain the relationship with your child. Oftentimes, parents will get into these conflicts, and they'll be like, "Oh, I don't want to hear about it. I don't want to talk about it." That's not necessarily the best thing. It can be very, very painful to hear what your child is going through, but you need to make sure that the lines of communication are there. Now, this is tough. My goal when I'm working with somebody, I try to be non-judgmental. When I speak to them, I just try to offer. So it was kind of like the concept of motivational interviewing. Why do you do the things that you do? What are you getting out of it, right? It's because you want people to change behavior on their own. I'm a father. I can't do motivational interviewing with my kids. So I think that concept is really, I think the first thing about it is opening up the lines of communication. And guess what? Maybe a way to open up the lines of communication is to kind of share your experience. I mean, what you feel comfortable with. But I think that's really, really important, because if you're going through this, this person's bad, blah, 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 you can't be this, I forbid you from being with that person. Some kids will just find that person to be more attractive.
You'll be pushing them into the arms of the person you want it to be.
And then they'll be doing things behind your back. Yeah. I mean, it reminds me of the story of Mark Twain. Mark Twain had said that when he went to college, his father was the dumbest person that he ever knew. And after a year of college, he came back and he was surprised by how much this man had learned. So the moral of the story was that really that backwards, or was there a certain level of maturity that that Mark Twain garnered? So I think that's one of the things that you really want to get. Because I see it all the time. I mean, if you get into these power struggles, I mean, it's almost cycle of abuse, cycle of discussion back and forth. It becomes problematic. I don't know if you're really getting that much out of it. I think it's really, you've kind of have to see where your kid is at, and just talk to me. What are you getting out of this? And is the relationship with this person, is there something that the family structure may be missing?
Yeah, what's missing? That's so fascinating, because when I work with parents of teenagers, I always say, look, to understand what's going on, I always point them in the direction of watching that PBS documentary. A PBS documentary was done called The Teenage Brain. And I have students, I teach the developmental span, the lifespan development class. I teach at my institution. And I have students in the class watch that documentary, but I also have some of my clients, you know, who are parents of teenagers, or if I'm working with teenagers and I talk to the parent, I always say, watch that documentary called The Teenage Brain, because it just lets you know they're like big 3-year-olds. They're going to be impulsive. They're going to want to assert their independence because they're trying to figure out who they are. And I love that because the non-judgmental piece is so important, because they will be rebellious. Like a little 3-year-old is going to be rebellious because, you know, they're trying to assert themselves and find out if they want to come out. You want your children to come out of these stages feeling confident and being allowed to make mistakes, to date somebody who you can look back on and learn from. And the main piece that you said that I thought was so spot on was, this is a time where you really have to establish and maintain open communication with your teenager. Like, that's the answer. That's the answer, y'all.
even if they get on your last nerve. I mean,
yeah.
Got to do that. And also, as a parent, hopefully this thing that I'm saying will help. The prefrontal cortex, the frontal part of our brain, this is where executive functioning is implemented. And we look at disorders like ADHD, the neurodivergent disorders. It's basically a problem within the prefrontal cortex. That is not fully developed until you're 23, 24, 25. And for guys, it's even later.
I believe it.
Okay? So, again, if you're going to have a relationship with a teenage kid whose prefrontal cortex executive functioning is not established, and you're so mad that you tell them, you know, I don't want to deal with you. Get out of my face. This is your problem. Think about what have you done? Because as a 40-year-old, as a 50-year-old, your prefrontal cortex has been established.
Yeah.
You have hindsight. And what is hindsight? Hindsight is basically learned past experiences.
Yeah.
Your kids don't necessarily have that. Now, technically, you want to be able to share your experiences, but how do you do that in a constructive manner? Because you want to lower their defenses. You know, you don't because if a person comes at you and it comes across as if you're attacking them or you're minimizing them, that's you've kind of lost the battle. And look, I know what easier said than but I think that's really the key. That's really the key.
No, that's really good. I just don't get into power struggles. And you know, you have to remind yourself, first of all, I just want to say, full disclosure, I'm in the thick of it. I got a 14-year-old, an 18-year-old, and I got a 22-year-old. All my children are old enough, but their prefrontal cortex is not is still developing. So I got, oh Lord, what now? You know, but I think like what's so interesting is that when children are rebellious, you have to look at it and say, this is a good thing. It's developmentally appropriate for them to challenge you a little bit. It's just, you know, it's development within some boundaries, of course. It's developmentally appropriate for them to question things. One thing I noticed when I worked with teenagers in high schools, by the time they were a senior in high school, all the things that were bothering them, that was going on with family dynamics, for some reason, they were telling it. Like something happened developmentally. By the time they were a senior in high school, they were noticing everything. They were pointing out everything. They were vocalizing all of the things that they couldn't quite make sense of, but they had this ability to really vocalize it. And I had to step in and say, yes, teenager, I understand that this is how you're feeling. It makes sense to me, but let's now learn how we can say things in a way that's healthy and not in a way that is going to tear people down, and just being brutally honest. So it was a wonderful teaching mechanism. I miss my days working with working with high schoolers. Now that I'm going to have a dream about working in Chicago, South Side of Chicago, with teenagers back in the early 90s, early 2000s, late 90s, early 2000s. That was my stint doing that type of work. But yeah, I mean, it's developmentally appropriate. And, you know, I'm in a position and you're in a position, this is what we've done. You know, we've worked with this population, and a lot of people don't understand. So I hope people are learning about what it's like to have to interact with teenagers, and how complicated it can be, and how you can maintain a good connection with them so that they can come out of these teenage years having a sense of purpose, feeling good about themselves, but also developing their own individual identity. They are not you. Your teenager is not an extension of you, parents. What you gonna say to that?
No, I want to share a personal story that really emphasizes what I'm talking about. I'll never forget. I'm a college student, and this is between my first and second year. And I'm showing my age, but there was this thing called the Long Island, Greek Fest, whatever. And it was a Saturday. I wanted to go to this place, party, all that kind of stuff. I made the mistake of taking the paper, my hometown paper, and reading an article. And in the article, there was an article that spoke about my kindergarten friend who was a student at Boston University, and yet started a program where he was teaching incarcerated African-American males how to read. I took this article, I showed the article to my dad. Okay. Now, granted, I'm getting ready to go to teaching, I'm young, ready to mingle. My dad looks at the article, reads the article, and says it in a loving way, but somewhat firm. This is something that you should be doing.
Oh.
Now, do you think I went to Jones Beach after that statement? Because
oh my God.
It wasn't like, oh my God, you should be. It was like, dude, I mean, this is your buddy from kindergarten, and he's doing this stuff. And again, I don't want to be too too restrictive, but
yeah,
it had an effect on me to give back, and that was the way my parents raised me and my two younger brothers. It wasn't like no. It was always this talk, this okay, you want to do this? I mean, you think you're a man? Okay, fine. I mean, do man stuff, but I mean, what are the ramifications?
Oh my God, yeah, that is so good.
And I always felt that was so effective. And again, now as a dad, I'm like, my God, this guy, my parents knew what the heck they were doing, and again, as therapists, I mean, I'm sure you relate. Again, we can't necessarily tell our patients what to do. We can't. I mean, we have to be not
self-determination.
Exactly. But that's like a lesson, and it is the key thing. Be careful of getting into unnecessary fights, but by the same token, you still have to be engaged. And I know that's a little bit hard to figure out. So, for example, the example that I gave you about my dad was engaged. He just said that, this is something that you should be doing, I mean, he didn't tell me not to go to Jones Beach. He didn't say it. He just said, okay, what is your contribution? What are you giving back?
Yeah, and you also learn from what they do. It's interesting. I'm glad you shared your story. And, for me, I don't, both my parents were therapists. I grew up with them. That does not mean I had a perfect childhood, by the way. I'm just saying. But it is funny because my dad, he even married a therapist. So so everybody who was responsible for raising me had advanced degrees in child development. I will say that much, So, but it was just so interesting. You learn too from those little teachable moments, but I also learned from what they did and how they lived their life. I mean, it had an impact on me. I don't know if they were conscious, like purposely living their life this way, knowing that it would have an effect on me. But it really made me, like my dad, he was studying to be a therapist back in the late 60s, during the civil rights movement. And so he was always like, anti-fight the man, it was kind of like that, wearing dashikis and stuff. So it's just getting into his Blackness. And, that definitely has an impact on me now. So this is really great. So we're going to start winding up. I do want to say hello to everybody. I do want to let people know, if you're interested in working with me, you can contact me at Coaching with Dr. Alicia. I do want everybody to know that you can follow me on social media, on Instagram at Coaching with Dr. Alicia. And the third thing I want everybody to know, you can text the word love to 87948. You'll get information, helpful information about when I go live, and also when we have great conversations like the one I'm having today with the Miss Dr. Ulrich. And he is a psychiatrist, everybody. So let's talk about, before we wrap up, I want to talk about self-esteem. So, when we're working with adolescents whose self-esteem is still forming, identity is still forming, how does a toxic partner kind of exploit that stage? And what are some protective things we can do? Anything else that we can do when we are spotting this sort of narcissism and toxic relationships? What are some things that we can do with our teenagers to help, with this emerging self-esteem that a lot of teenagers are trying to have at this stage, when we see that there is exploitation going on? What can we do to help protect our teenagers?
One thing is discussion. Making sure that you're talking to your child. Another thing that I find that would be helpful is talking to your child and talking about their goals. I will tell you, when I'm in the emergency room, and if I have a patient that comes in and says that they're suicidal, one of the ways that I gauge the severity of the suicidal ideation is whether this person has hopelessness. If I ask where you see yourself in 5 years, and look at me like 5 years, I don't see myself around, that's a concern. If they say that in 5 years I see myself graduating from college, that's a positive sign. So I would talk. So if you're concerned about that your child may be in a toxic relationship, talk about, what is your plan? Do you want to go to college? And college is not for everybody, but where do you want to see yourself? Where do you want to be in 5 years? And do you think that the current road that you're on will lead you to accomplish that goal? Because then by you saying that, you're making them think, empowering them.
Wow. So the remedy is more in the question than it is in whatever answer they give you. Is how they answer the question. If they say, I don't see myself around in 5 years, or if they say, oh, I see myself doing whatever, a painter, a writer, going to college, an engineer, or whatever they want to do, just as long as they have an answer, you can connect them to that.
Exactly. And in addition to that, you also want to talk to your child. A major concern, I've seen this happen all the time, especially with young children that are being exploited, is substance abuse. You've got to have that discussion about drugs. And right now, marijuana it's so common.
Yeah.
But studies have shown, I have a lot of kids that have cannabis use psychosis, right? It's so just because it's common it doesn't mean that it's healthy for you, especially in a developing brain. So you need to have those discussions, and so you also want to ascertain whether substance abuse is a part of that relationship.
Mm.
And again, we're therapists. We are here to help. Don't be afraid of looking for help. It's better to get help early on than later.
Yeah, I mean, that is good. The use of cannabis. I wish I had asked that question because like it is, you talk about really being part of young culture now. It's just supposed to be okay. And I can't tell you how many teenagers never recover from a cannabis-induced psychosis. Like it affects them forever. And that's just sad that it's come to that. It's not regulated the way it needs to be. It is not the cannabis that probably my parents used back in the 60s and 70s. I don't know what they were into, but this is something totally different nowadays. And it's something that for a lot of people can't be reversed. And then you have that stigma attached to yourself. And it's a very scary, traumatic experience when you're in having contact with substance use like cannabis, and it just sends you off the rockers. What a terrible experience.
In addition to that, I mean, cannabis, it's still, I mean, some people may disagree, but I'm from the school of thought that cannabis is still a gateway drug.
Yeah.
It can lead to cocaine. It can lead to heroin. I mean, I have yet to treat a person whose first involvement with drugs was crack.
Yeah.
I've not seen that. I mean, I've seen people basically take one drug and they kept on, maybe the crack was the second or third drug, but I've never seen a person, well, I just decided to take crack.
Yeah, I was telling my husband the other day, I was saying, well, first of all, when this cannabis, you develop a tolerance. So you have to keep taking more and more of it to get the same effect, which, like who needs that? But I was telling my husband the other day, I was like, yeah, I probably could do drugs and alcohol and stuff, but I was too ambitious. I was too ambitious to do drugs and alcohol. Like, yeah, it was probably fun to party and to be intoxicated and all that was fun, but I just didn't see how I could fit that type of lifestyle and still be able to achieve my goals. So I think it's so important to talk about goals, because goals, having a desire to want to do something and connect with my greater purpose in life, that really in and of itself, gave me the ability to just not really have time. I didn't have time. I was so busy trying to become a therapist. I was so busy studying. You have to memorize all that stuff. I couldn't take a toxin trying to pass my licensing exam and get through those courses. There's no way I could have done that. So it just was incompatible with what I wanted in life. And that's really the reason why I never really drank alcohol or used drugs at all. It's just that I didn't fit. It didn't fit in my world. And then once you start having children, you for sure can't use drugs and alcohol and be an effective parent. That's not going to happen. You have to keep your faculties about you. So I love this. Parents, everybody here, connect your children to a goal in life. Help to support them. That's part of it. It will encourage them to be good to themselves, to have great self-esteem. And, that's part of the battle. We're protecting our children from predators. Teenagers think they grown, and there's adults and people who like to prey on boys and girls who think they know it all. So I think this is a really interesting conversation today. I want to sum all of it up because I've been writing down, y'all don't know, I'm writing down all these notes because I got 3 teenagers. I got a 22-year-old. That's still like a late adolescence in my book. So, so let me tell you what all that Dr. Ulrich has told us about parenting teenagers who are in this dating area. He told us that toxic relationships are mental, physical, emotional, and social abuse. Then we talked about isolating, not letting people have friends. Let your friends have friends. Let your boyfriend have friends. Let your girlfriend have friends. That's healthy. You can't have them all to yourself. Sharing the location, well, I guess that's just the cultural norm, but you got to figure out why share the location. Is it just because that's what everybody does? Or is there somebody trying to keep tabs on you and try to tell you where you can go and where you can't go? So we got to have a conversation about boundaries. We also talked about, let's see what else. Oh, we talked about epigenetics. We talked about, oh my goodness, we talked about the brain. We talked about what cortisol does. Cortisol in the body is inflammation. All of this stuff we have to be careful about because the brain is still developing. And when you have high levels of cortisol, your prefrontal cortex, is that right, Dr. Ulrich? Prefrontal cortex is damaged and you aren't able to make really good decisions and you're impulsive. All of that's what that has to do with. So also, we also talked about making sure that your teenager, the best intervention for making sure that your teenager and the teenagers out there, y'all have to be connected to somebody. Maintain that close emotional connection. Make sure you don't be judging everything that they do. Understand that teenagers are still trying to form their identity, still trying to feel good about themselves. Y'all take a look at that PBS special, The Teenage Brain. Anybody working with teenagers, anybody got teenagers in the house, watch this documentary with your teenager. Have a conversation. Let that be the platform for you to engage. Definitely drugs and alcohol. Need to stay away from that because guess what? Cannabis, it's starting to become really popular in our culture. But guess what? You can have cannabis-induced psychosis. I know people personally who've had this happen. I know clients who've had relatives to have this happen. It's very difficult to come down from there. It's something that's going to be attached to you forever. Oh my goodness. Goals in life. Anything that I left out? Any message that you want to give the audience, Dr. Ulrich, before we wrap up for today?
Goals. In order to have goals, you have to have a dream. And dreams are gifts that we give to ourselves. So you want your child to be able to love themselves by giving a gift to themselves. And that gift can be a dream, and that dream can lead to a goal. It's about self-affirmation, self-acceptance.
That is beautiful. Thank you, Dr. Ulrich, for joining me. I'm so happy you ran into my husband. I'm so happy he was like, oh, let me connect you with my wife. And I'm so happy to have you on here to share your wealth of information. I'd love to have you back. Family, hey, everybody, Healing Haven family. If this helped you in any way, hit that like button, share it with every teen that you know, every parenting group that you know, and subscribe to Coaching with Dr. Alicia. Y'all follow me on social media. Let me pull it up here. Follow me on social media so you know upcoming people. I'm Coaching with Dr. Alicia on all platforms. And Dr. Ulrich, let's everybody give him a round of applause for coming on here and imparting such great knowledge. Until next time, remember everybody, healing is a practice, love is a choice, boundaries are beautiful, and I'll see you guys soon. Bye-bye, everybody.